Loperamide is a medicine to treat diarrhea. It can help with short-term diarrhea or irritable bowel syndrome. Loperamide is also used for recurring or longer-lasting diarrhea from bowel conditions such as Crohn's disease, ulcerative colitis, and short bowel syndrome. If you have a colostomy and opening in your stomach to collect poo from your body, loperamide can make your poo thicker. It does this by slowing down your food as it passes through your gut. Indications for the symptomatic treatment of acute diarrhea of any etiology, including acute exacerbations of chronic diarrhea for periods of up to 5 days in adults and children over 9 years. For the symptomatic treatment of chronic diarrhea in adults. How to use? Take this medication by mouth with a glass of water. Follow the directions on your prescription label. Take your doses at regular intervals. Do not take your medication more often than directed. Talk to your care team regarding the use of this medication in children. Special care may be needed. Overdosage. If you think you have taken too much of this medicine, contact a patient control center or emergency room at once. Acute diarrhea. Adults and children over 12 years. 2 tablets 4 mg initially, followed by 1 tablet 2 mg after every loose stool. The usual dosage is 3 to 4 tablets 6 to 8 mg per day. The maximum daily dose should not exceed 8 tablets 16 mg. Children 9 to 12 years, 1 tablet 2 mg 4 times daily until diarrhea is controlled, up to 5 days. This dose should not be exceeded. Future investigation into the cause of the diarrhea should be considered if there is no improvement within 2 days of starting treatment with loperamide. Chronic diarrhea, adults. Patients may need widely different amounts of loperamide. The starting dose should be between 2 and 4 tablets per day in divided doses, depending on severity. If required, this dose can be adjusted according to a result up to a maximum of 8 tablets daily. Having established the patient's daily maintenance dose, loperamide may be administered on a twice-daily regimen. Tolerance has not been observed and therefore subsequent dosage adjustment should be unnecessary. Contraindications. Loperamide is contraindicated in patients with known hypersensitivity to loperamide hydrochloride or to any of the excipients. Children less than 9 years of age. Loperamide should not be used as a primary therapy. Patients with acute dysentery, which is characterized by blood in stools and high fever. Patients with acute ulcerative colitis. Patients with bacterial enterocolitis caused by invasive organisms, including Salmonella, Shigella, and Campylobacter. Patients with pseudomembranous colitis associated with the use of broad-spectrum antibiotics. Special warnings and precautions for use. Treatment of diarrhea with loperamide is only symptomatic. Since persistent diarrhea can be an indicator of potentially more serious conditions, loperamide should not be used for prolonged periods until the underlying cause of the diarrhea has been investigated. In acute diarrhea, if clinical improvement is not observed within 48 hours, the administration of loperamide should be discontinued and patients should be advised to consult their doctor. Loperamide must be discontinued promptly when constipation, abdominal distension, or ileus develop. Side effects. Dizziness, drowsiness, tiredness, or constipation may occur. If any of these side effects persist or worsen, contact your doctor promptly. If your doctor has prescribed this medication, remember that your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Stop taking this medication and get medical help right away if you have any very serious side effects, including severe constipation, nausea, vomiting, stomach, abdominal pain, uncomfortable fullness of the stomach, abdomen, fast irregular heartbeat, severe dizziness, fainting. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing,